So trying to give a big picture of some of the things that can make someone more susceptible to having more pain. Um, and those three M's are ways of sort of categorizing it: mechanical, metabolic, mental, emotional. And there are also ways to think about what to do about it. So let's go in order. Mechanical, structural stuff. After joint replacement surgery, mobilization is the thing, because mobilization is what causes the body to take away that swelling and inflammation that happened. Mobilization of the tissues, mechanically mobilizing the joint, moving it, walking. That's why they want to get you doing physical therapy as much as possible. And my recommendation to people frequently is that if physical therapy hurts like heck, take medication before physical therapy, because the most important thing is getting yourself moving. It's normal, there's going to be pain. It's a short-term post-operative thing. Unless you have a huge issue previously with addictions, don't be worried about taking an opioid. There's strong opioids like Percocet and Dilaudid. Oxycodone is Percocet, same thing. There's also weaker opioids like Tramadol. You got to find what works for you. Some people get whacked out mentally by opioids. So look, if oxycodone or Percocet makes you confused, take half of one. If that still makes you confused, try Tramadol or Tramadex, which is medium strength, has less tendency to hurt. So that's a very reasonable thing to do. The other medication-wise thing that's relevant is what we call adjuvant medications. So it's not just opioids. That's the way a lot of surgeons think, a lot of internists, they think post-op pain, opioids. But let's broaden it out. There's different classes of medications. The second class of medication that's worthwhile thinking if you don't have any contraindications is non-steroidal anti-inflammatory medications. So for a few days, those don't tend to be toxic. You want to check with the surgeon to make sure they're not scared about implications for bone healing or bleeding. These aren't things to just do casually. You should check with the doctor. But taking 400 or 600 milligrams of ibuprofen in the day before you go to physical therapy can frequently be a good idea. If ibuprofen is not a good idea because you have a tendency towards bleeding, or the surgeon's concerned about bone healing, or you have a history of heart disease and you're concerned about those complications, Tylenol can also help. So 2 Tylenol, regular strength, is 750 milligrams. 3 Tylenol is about 1,000. Most people, unless you have liver disease, can easily tolerate taking 3 Tylenol twice a day, before your morning therapy, before your afternoon walk, just to help you move better. We're not talking about long term, we're talking about enabling you to mobilize. All right, make sense? Mobilization is huge, moving is huge. A lot of physical therapists get trained to do mobilization, and they don't think about manual treatment. Manual treatment is hands-on treatment to tissue. Tissue gets restricted and tight. I've seen people a week or 2 weeks after surgery where they got a massive spasm or just kind of constriction, not even at the surgical site, but in a connected anatomic location along the leg. And that spasmodic tissue, which may have gotten worse because of the surgery, because our body responds to pain by tightening down. Imagine you touch a hot stove, you pull back immediately. The surgical site's like a hot stove. It evokes muscle spasm. Some people have more muscle spasm than others. There are manual techniques for releasing spasm. Acupuncture can also release spasm. If you're going to get acupuncture, make sure that it's appropriate giving whatever blood thinner medicine you might be on to prevent blood clots. But acupuncture is another choice. Manual therapy, the right kind of massage by someone who's really skilled in working with post-operative people. I tend to like people to see a physical therapist who's got good manual skills in a post-operative period, because the physical therapists are more familiar with the issues around that surgery. So pursue these things, but don't pursue them casually. Get advice from someone who knows about these things. Don't be too much of a cowboy about it. Ice, cold, heat, yes, good. Immediately post-operatively, you should be icing all the time. Frequently, that helps people a lot. Certain people can't tolerate cold. In the first few days after a surgery, I wouldn't recommend using heat because it can evoke too much blood flow to the area. But when you're already a week out, when the initial acute inflammatory response starts to go down, you can use heat to relax the muscles, to get the whole thing to relax and move easier. Warm muscles are more flexible, more easy to move without pain. So don't forget about ice and heat. That's kind of a bridge to the biochemical stuff, the metabolic stuff, um, because ice and heat are metabolic biochemical treatments on a certain level because they reduce blood flow and change biochemistry a bit. Um, Things you want to think about are there any deficiencies, right? Are there known neuropathic problems, meaning like nerve damage issues, whether it be spinal stenosis or or neuropathy from diabetes or other causes, or fibromyalgia? Those are all things that can make the pain processing system more sensitive. So there are medications to work with that. I wouldn't be afraid to ask your doctor to think about prescribing either gabapentin, which is Neurontin, or Lyrica, which is pregabalin. Those are both medications that are fairly safe for most people and can reduce irritability of nerves. A lot of people I've seen after joint replacement surgery can't sleep. They just can't get comfortable, and they got this burning, aching pain. They take their Percocet or Tramadol before they go to sleep, but those meds are only meant to last 3 or 4 hours. So they wake up at 2 o'clock in the morning, and they have to wait till the morning to get their next Percocet. And so they're lying there in pain all night. They're not sleeping. Guess what? Not sleeping makes pain worse. Guess what else? If you take a Percocet together with 300 milligrams of Neurontin or gabapentin, the gabapentin potentiates that Percocet. They work together. It's a synergy. They're completely different mechanisms, but 1 plus 1 is 3 frequently. So it's something that's reasonable to try with medical supervision, to take gabapentin 300 milligrams before bed along with your Percocet and see if that helps you get 6 or 7 hours of sleep through the night. Like, I can't count the number of people we've done that with, and I come back the next day or 2 days later, they go, "Oh my gosh, doc, I'm sleeping. Thank you so much." And then everything's different because they're sleeping well. It reduces their inflammation, reduces stress, reduces muscle spasm, reduces irritability and pain processing. So it's a kind of a no-brainer to focus on getting sleep. Those medications can also be used during the day. Both gabapentin and Lyrica, also called Neurontin and pregabalin, can create cognitive impairment. They can make a person tired or fuzzy, so be careful with dosing. Someone who's older needs a decreased dose. If you have decreased kidney function, you need decreased number of times per day that you take it. They're not toxic to your liver or kidneys, but they are eliminated by the kidneys, so you need to just know what your kidney function is. What else? Making sure you got enough B12, making sure you got enough vitamin D, and considering taking a bunch of magnesium with vitamin B6, even if your magnesium level is normal. Your serum magnesium doesn't correlate to your tissue magnesium. When your body is depleted in magnesium, you have a tendency towards muscle spasms, cramps, and increased sensitivity of pain processing. There's a kind of an epidemic of magnesium deficiency because most docs just measure the blood level, but the main tissue stores are in the bones and muscles, and the body maintains the blood level at the expense of the muscles and bones because your brain and heart will stop working if you don't have enough magnesium. So if you have a net loss, like you're losing more than you take in, why do people lose magnesium? Stress, alcohol, diuretic medications that are like what do we call those? Water pills, yeah. They deplete the magnesium from the body. And for the most part, our food source doesn't have enough magnesium in it anymore. Our soil's depleted because of farming. So these are known things. These are not imaginary things. There's data to back it all up. So if your kidney function's normal, magnesium is not dangerous. If you take too much, you'll pee it out. I usually recommend people take it 3 times a day. Magnesium oxide's not well absorbed. The organic salts of magnesium, the ones that ends in 8, like magnesium citrate and malate and glycinate and other things that end in 8, ATE, those are better absorbed than magnesium oxide. What else? Those are the main things there. The last piece is the mind-body piece. And so, if you have pain that's keeping you awake and making you nuts, you need to learn how to relax and let it go. And it's not so hard to do. Part 2 of this video series is going to have a meditation in it. So that should be right on the heels of this one. what I want to say is that um, the importance of the mind-body connection isn't dependent on you being crazy, right? It doesn't mean that there's something wrong with you or it's all in your head. The fact is that your mind and body are totally connected with each other, and so regardless of what's going on with pain, doing some kind of relaxation exercise is really important. If you know that you have anxiety, or you have OCD, or you have bipolar disorder, or depression, or something else that has to do with a tendency towards being in emotional distress, then it's a really good, really good idea to do some regular kind of evocation of the relaxation response. So next video in this series is going to be a very simple meditation that you can do wherever you are. So look for it, and I hope you recover well, my friend, and whoever else sees this video, I hope it's been useful. Think about going to the Facebook group called What Heals, because that is an ongoing conversation about integrating scientific medicine with natural healing and common sense. And you can also go to my own webpage at www.drschiller.com and get on the mailing list there. And there's a fairly regular newsletter blog thing that goes out there. So I look forward to being in touch with you. If you like this video, please leave a comment, like it, forward it to your friends. You can share it on Facebook by clicking under the video on the share it button there, and share it in Messenger. You can share it on another page or group that you participate in. So thanks for listening. Wishing you all the best.